Hey everyone, it's Dr. Jen, board certified pediatrician and parenting expert. And today is Ask Dr. Jen, talking all about keeping kids healthy, decreasing chronic diseases, really talking about establishing good, healthy habits. February is American Heart Month and talking a lot about prevention in adults, but really what we need to know, especially as parents, is that heart disease and other chronic diseases, diabetes, obesity, type 2 diabetes, it all starts in childhood, and osteoporosis and bone injuries. So we really want to make sure that we are keeping kids healthy right from the start. And that's really about having positive, healthy habits for kids and instilling those habits, because a lot of experts are now saying that the next generation of kids may have a shorter, really facing heart attacks in their 30s and 40s and really having a shorter life expectancy than we do now. And it doesn't have to be that way. We can really change their habits, because we know that your habits from childhood, they continue on into your adult life, and they have a huge impact on your overall health. So as parents, we can do so much to help our kids. It's not just your genetics, really your behaviors and your habits of what you instill in your child. They just continue, and really you can break bad habits, but continuing good habits really make it easier for kids. So today I really want to talk about some heart healthy habits that we want to help our kids with right away. And so these tips will not only help with our heart, but with other chronic diseases as well too. So first of all, let's start with exercise. So moving it is so important, getting that heart rate up, and we want kids to exercise right from the start. So kids should get at least an hour of heart pumping exercise every single day. And it could be anything, right? It could even be broken up into different time periods, but we want their heart to be beating. We want them to be moving and stretching, weight-bearing exercises. So running is great, running around, playing on the playground is great. Sports is also a great opportunity for kids to learn sportsmanship and working together. But at the same time, again, you want sports that are active. And it's great to find sports in kids that they like and that they'll continue to do. A lot of kids stop sports and activities around 12 or 13. So trying various ones throughout the year, especially when they're young, can be extremely helpful. It's also important for kids to do more than one activity, because otherwise you can get a lot of overuse injuries if they're just using that same muscles all the time. So you want to use all the different muscle groups. So playing different sports is a great idea through different seasons, especially particularly when they're growing as well too. And for me, what we know is that kids who exercise end up being adults that exercise too. So even instilling sports when they're young, they may do karate when they're young, but then when they're older, they may want to do another activity. So I was really active. I liked gymnastics and dance when I was young, but now I do things more like Pilates and bicycling. So you can change what you do, but just being active as a child is more likely for you to continue that. And being active really helps, as I said, with cardiovascular health. It's super important. And you have to remember, as a family too, it doesn't always have to be an activity like a sporting event as well too, or a competition or a team sport. It could be one-on-one, it could be running, it could be jogging. But again, raking the leaves, going on a family walk, or walking the dog, going to the playground and having your kids run around is a great way for them to get exercise as well too. So just being active, doesn't have to be on a team sport. So I think that's important to know too. You can just have great family time going for a walk or a hike as well too. So another tip that's really important for heart health is to eat more plants. So having a plant-based diet, and again, I'm not saying that you have to eat no meat at all, but having a plant-based diet where you're eating much more fruits and vegetables and whole grains and less emphasis on red meat can really make a difference to heart health. And I know parents are always obsessed and concerned with their child getting enough protein, but in fact, kids usually eat more protein than they even need. So there are certainly other sources besides red meat to get protein from, and again, it's fine, but you don't want to do that on a daily basis. There are other proteins. There's fish, and there's lean chicken and turkey as well, eggs, beans, lots of fruits and other vegetables you can get some protein from as well, yogurt, dairy. So there's lots of ways to get protein. It doesn't have to be from red meat. Another thing that's important too is the portion size, right? So we always think of the side dishes as being the vegetables. And so again, if you think of that as being the bigger portion on the plate and have smaller amounts of protein from red meat, that can really help as well too. So again, portion size is really important too. Also, when we're talking about foods, it's how you prepare them as well too, right? So you want to really de-emphasize fried food, fast food, smoked and cured foods as well too. They're high in salt and nitrates as well too. But you want to then think more about sauteing and baking and steaming and getting kids used to that at a young age, because they'll enjoy it. They can taste the flavors of the foods. So again, it's just about continuing to introduce these kind of foods as well as the way that prepared, and that can make a big difference. You just have to keep on doing it over and over. And if they see you eating it and that's what you do in your family, you're more likely, with given a wide variety at a young age, for them to continue to do that into adulthood as well too. Even if they seem a little bit picky, you'll see it picks up, and I see that often. Kids go through that picky phase, but then when they become adolescents, they become more adventurous, more like what the rest of their family has been doing too. So never give up. Keep on showing them the healthy foods, and try to make it as much plant-based as possible. Another food and nutrition tip is to ditch the desserts. And what do I mean by that? Do I mean that you never can have dessert? No, but don't make dessert part of meal or dinner, for example. Don't have an expectation that you eat your dinner and then you get a big dessert. You should eat dinner, for example, if that's the meal, and then you should be feel satiated or full from dinner, and then you don't really need to have any type of dessert. You should be eating the foods, the nutrient foods, and then that's really it. If later on in a few hours they are hungry and they need a snack, I mean, always start with a glass of water or even a glass of milk if your child likes that, and then a piece of fruit or something, a healthy option to eat. Don't assume tell them because they ate they can have a non-healthy or cake and cookies just because they ate their dinner. So they just get into a bad habit. Can they have that? Yes, think of it for more special occasions or small amounts, but you don't want to attach dessert with meal, thinking that it has to be every single day. And I think that could be really helpful. But when you do give desserts, for example, and it is something like, for example, my kids love ice cream, and so is that ever going to go away? No, I don't think so. But when you give it, your portion control and portion size is really, really important too. So, for example, if they like to have frozen desserts and ice cream. So sometimes you can have sorbet, or frozen fruits is a great way to do it as well too, to mix it up. And if they get ice cream, that's fine. But again, the portion size, start at a young age. Just one serving of ice cream, it will fill them up. They'll feel good. They won't feel deprived. But there's never any reason to give 2, 3, 4 scoops of ice cream, especially at a young age, because then they'll continue to want that. But if you in your family, eat it in moderation, then they'll learn that too, and will feel okay and happy to have that one scoop of ice cream as well too. So again, it's not about deprivation, but it's about really thinking about what they're eating, and giving healthy options as much as possible, and certainly treats when necessary, and for special occasions too. So another really important thing about heart health is, I call it chatting with your child. So it's never too early to be talking to your children about healthy habits and heart health, but also about risk-taking behaviors. So now I know that a lot of people, sort of don't want to talk to their kids about drugs and alcohol because they think they're not going to listen to them. Their kids roll their eyes. But it's really, really important, in fact, that we know that kids whose parents speak to them, they have a 42% chance of a decreased risk of doing drugs and alcohol than those whose parents don't speak to them. So speak up. It's really, really important. We're seeing more and more smoking with kids, and you also have to know about how to frame it, and I think this is important. I want to bring this up. So as a pediatrician, I see lots of preteens and adolescents, and if I ask them, do you smoke, one of them say no, because they're just assuming I mean cigarettes. So you have to be really specific. I think you need to know about e-cigarettes, and e-cigarettes, the most common one that kids use is something called juuling, and when they do this, they sometimes don't consider it smoking because it's tobaccoless, but it has high amounts of carcinogens and chemicals in it. It has high amounts of nicotine that are really, really addicting. In fact, one cartridge has the amount of nicotine in a pack of cigarettes. So it's really, really addictive to young kids, and they may not know that. It comes in fruity flavors and minty flavors. And so again, it sort of entices them to use it as well too. So, and what I'm seeing in my practice and I hear from family friends is that their kids didn't know and they're using it, and it's highly addictive. They're getting headaches and they're getting stomach aches and diarrhea and anxiety and nervousness and stressfulness, and they just have to continue to keep on using it. Their body craves it, and it's disrupting their school. And what the new studies show is that the e-cigarettes, it does seem to be that it's so addictive, and that those who do use e-cigarettes early on are then more likely to use cigarettes. And again, obviously, cigarettes, we know is an extreme risk factor for lung cancer as well as heart disease as well too. So it's important to talk to your kids and talk to them often. They will thank you for it. And even if they don't do it now and they roll their eyes, but they are listening to you and you are their role model, and they want to hear from you even if they are not even looking at you when you're speaking to them. So bring it up often. You need to talk about drugs and alcohol, smoking with kids. So it will really, as I know, parent involvement is really important in decreasing the use of drugs and alcohol in kids. Lastly, I just want to talk about preventive care visits. So when you want your kids to go to the doctor, so it's important for you to go to the doctor for preventive care visits too. Some people say, well, I'm healthy, why do I need to go to the doctor? But there's so many things. We make sure that they're up to date on their immunizations. It's a great time to speak specifically about if there's any family history of heart disease or other chronic diseases, right? You can find out specifically what you need to do. They will obviously take your height and your weight and your BMI, blood pressure. So all these things we want to follow closely. There's certain lab tests that need to be done, and even cholesterols and other tests that are done at your doctor's office as well as when your child goes for their checkups. So seeing you go for your checkups as well and taking good care of your health, again, that's important to model that for your kids too. But keeping them healthy, and when you get to go to your pediatrician, right, and you get that individualized attention specifically and answering all your questions and talking about ways to reduce and improve healthy habits in childhood, so then they can also decrease chronic disease and improve longevity and health as they age. So it's important to start early, because kids that do go to see their pediatrician are up to date, continue more often to continue to get health care and prevention, which is key for health and, as I said, longevity. So I hope these factors really helped you to see that we do need to start early on in childhood when we're talking about healthy heart. We don't want to wait till you're 30 or 40 or 50 to make those changes, because we're seeing, as I said, even in young children now, we're seeing increased obesity, and we're seeing even fatty streaks in their arteries now as young children, and plaque buildup to begin with. And you don't really know that till later on. So start early, exercise, as we know, eat healthfully, really talk to your kids about risk behaviors, because that will really reduce the risk reduction, and make sure that you always go to your preventative visits as well too. This is Dr. Jen. Please leave me any questions or comments and I'll get back to you. Have a great and healthy Wednesday.